Hello, everyone. Welcome. I'm excited to have a wonderful discussion on mental health and holistic mental health. So, everyone said hi and has been so friendly and has been so engaged. And I think that's been a wonderful thing. So please keep that up. That's just a friendly kind of reminder. I'd love to hear everybody's thoughts. A bit of a housekeeping. I'm Hillary from the Practice Better team, by the way, and I would love to just give a little bit of a housekeeping talk. Hi, hello, Jay, Julie, Jenny. Hi. Please don't be afraid to say hi. Kim, I'm excited for this topic too. I've worked in mental health before joining the Practice Better team, and I'm really excited to be able to moderate this discussion today. Yes, for those who are on the East Coast, it is the afternoon. It might just be afternoon for those of us on the West Coast. So my housekeeping, please throw all of your messages in the chat if you just want to throw out a thought or react to the discussion that's happening. If you want to private message someone, that's in the messages tab. And then if you have Q&A, and we're gonna try to weave in Q&A in the discussion and try to get a little bit at the end. Please, if you have questions, put them in the Q&A. And so I'm able to notice them a lot more easily. All right, so thank you. Shout out to the clinical counselors, shout out to the therapists, shout out to the psychologists, shout out to the dietitians who love nutritional psychiatry. I know is becoming such a burgeoning field. Anyway, so I'm gonna get started. Almost a quarter of Americans experience a mental health disorder in 2022. And being a Canadian, 1 in 5 Canadians suffer in any given year. And that's from the Center for Addiction and Mental Health, for those of you who are Canadian and familiar with that institution. Integrative practitioners have an extremely important role to play in addressing this problem. And in a world where traditional approaches to mental health can often be really siloed and fragmented, the importance of a holistic perspective have never been clearer. And so we're joined by 2 experts in this field and who have very different backgrounds. And that's what's going to be such an exciting conversation today. But both of them believe in treating the whole person, mind, body, and spirit. And together they're going to share insights on defining holistic mental health and its significance today in the wellness landscape. I know everybody's talked about how mental health has really changed since the world changed a little bit. And as we get back to normal, some of these problems still stay with us. So join us as we unpack some critical topics and discover how a holistic approach can enrich our practices and transform the lives of those we serve, which is more important after all. And we all intersect with the impact and support of a client's mental health. Thank you, Greg. I think that's a beautiful, beautiful sentiment. So I'd like to introduce our 2 panelists. You can both come on stage if you'd like right now. That would be wonderful. So we have Dr. Wanro Yang, who is a psychiatrist and an MD, PhD. And she's got a diverse background in neurobiology, biochemistry, and neuroimmunology. And she's trained at the University of Washington and Johns Hopkins University and combines rigorous scientific knowledge with a holistic approach to patient care. Dr. Yang is passionate about understanding the mind-body connection and believes in deep listening to her patients, validating their experiences, and providing personalized treatment plans. She's also a mom of 2 and an experienced traveler and travel agent. Love a good personal, tidbit, factoid. She's explored over a dozen countries. And this experience, this life experience, all of this academic experience also informs her practice, where the focus is on empowering patients and breaking down medical silos. And now we have Meg Bowman, who's a friend of ours as well, and passionate about making trauma and mental health informed nutrition practice the default. She is the co-founder of Clinicians Incubator and Nested Health Coach Certification, and Meg supports the growth, training, development of nutrition and coaching professionals. Within her private practice, Nutrition Hive, Meg specializes in mental health and GI conditions. In her free time, you'll find her on the couch with her dog, drinking tea and reading a book. As a dog mom, as a doodle mom, also a huge fan of hanging out with my dog. Welcome to both of you. Thank you so much. I'm so glad you're here.
Thanks so much for having us. We're excited.
Yeah, thanks for the great introduction.
Amazing. I'm done talking. We're 5 minutes in already, and so I'll get right to the chase. How do you define holistic mental health, and why is it important in today's wellness landscape? This is the opener question, or warm up to get everybody going. What's your definition of holistic mental health?
So I'll go first because I'm coming from the mental health side, and I'm coming from, kind of what you guys are kind of adjacent to, right? In terms of you guys are looking at how to look at everything together. Whereas in medicine, we tend to pathologize mental health. So it's either you have a diagnosis or you're fine. And I think the key, I think, is that we're all going through something. I think that's definitely what the pandemic has shown us. People are like, oh, anxiety has increased. I think we just have more outlets for it. Of course, our anxiety has increased, but it's not like everybody has something wrong with them. But it's also true that the people who have diagnoses, it's not all in their head. And so then the other aspect that I think is really important is, the mind-body connection, both in terms of how, yes, it's true that when you have things going on with your mental health, it affects your body because our brain can control so many things. But then I think we also underestimate how there are lots of medical conditions that can, even independent of how it makes you feel sick, can affect your brain and your mental health. And so just trying to kind of make sense of all of that, and then in doing so, help the patient feel like we're looking at them rather than like a numbers or a label.
Yeah, Meg, I'd love to hear. I have a thought about that I'd like to probe, but I also want to hear Meg's perspective before I come back to it too.
Yeah, I think I'd actually love to give you just a little bit of a case study that I think really elucidates my views on this. So this was not one of my clients. This was one of my post-grad nutrition interns clients, but she had a 60-year-old male who was in a job that was a little toxic. And he was in a caregiving role, very high stress. And his chief complaint presenting for nutrition care was GI stuff, pain, diarrhea, urgency. And she was very smart in her work with him. She did all the things that you do GI-wise for that. But she also asked a lot of questions around, when are those symptoms happening? What's prompting those symptoms? What makes it better or worse? And she chose to add and layer on top of the GI support, she added a ton of mental health support. And she took his symptoms from an 8 out of 10 to a 5 out of 10. And then the guy quit his job and symptoms went to 0 out of 10. So it was, I think we all have these stories, but it's a great example of how mental health bleeds into everything else, every other part of life.
It's so important. And I think one of the things that I learned during my education was how beautifully Chinese medicine had already figured that out. Like when you talked about how the spleen, which is responsible for digestion, was affected by worry. That's actually a really elegant model for irritable bowel, for example. And then we have now all of this research. It's like it took the West a lot of time to catch up, and now all of a sudden we have all this research on how counseling is such an effective treatment for IBS. Anyway, Dr. Yang, I wanted to actually probe the idea of symptoms and things being in people's heads. Do people tend to come to you with that idea already? Do they get referred to you, or how do you have this conversation with people that maybe your physical symptoms are being caused by anxiety or depression?
So, there's such a wide spectrum. So in my residency training at Johns Hopkins, there was an inpatient for chronic pain, and so many of them had to get nutrition via IV, needed to have surgeries, and a lot of times then after they've had all their surgeries and after all these things, and they're like, okay, we fixed you. Now anything that you still feel, not they said it exactly, right? But they're like, well, I think maybe it's functional, which I know for you guys, it means it's something to really look at. But in medicine, it can be like a code word for in your head, right? And so that's definitely, so then I definitely see how disheartened they can feel because they still feel like something's wrong. And then on the other hand, there can be more mild symptoms, like more mild pain or feeling sweating. And those can often also be like side effects of medications because every body is different. And so there's a lot of patients who have tried a lot of different practitioners who say like, well, I don't see this as like a common symptom or it's not likely. But again, it's important to realize that like, that talk about the epigenetics, right? Like we are all very different and our genes express very differently. So
and I think that's so, yeah, go ahead.
Oh, I was just going to say the thing that I always tell my med students and also my patients is that what doctors say, they're not wrong in terms of like, okay, you don't have cancer. I think the thing that is lost in translation is that their job is to find sick or not sick. Their job is to figure out, do you have cancer? Are you on the brink of dying? Like, do you need to be in the hospital or do you need surgery? And so then, and those are pretty scary, right? Like we would want doctors to be able to find those things out. But then when they tell you, oh, no, you don't need that, they're thinking, they're either accidentally saying or they're heard as you're normal. But we are taught, like medicine is taught sick versus not sick, but there's a wide range of normal versus not normal that, needs so many other specialties to be able to kind of break down and help with.
That's where the wellness, I think that's where health and wellness practitioners can really play a beautiful role because that's where they play, that's where their work begins. They put work and play in the liminal area, in that gray space between sick and not sick, where, you always hear the walking well, where like, yeah, you're, but the thing that whenever I have an interaction with the emergency department, the question in me in like, but did you die? It's always in my head. Like they just need to preserve life. Right. And so there's a lot of really great gems in there. So having said that, you're both coming to it, like we talked about, from opposite ends of the spectrum. Meg, you're trained in nutrition and looking to mental health, and Dr. Yang, you're trained in mental health and maybe looking at nutrition, maybe looking at something else. How are you integrating? How like, what are can you just give us like some really practical examples of how the rubber meets the road with treatment, with integrative treatment?
Yeah, I guess I think it depends on the person. For me, I have obsessions about certain things. I'm not going to lie. I'm super obsessed about nutrition's role in helping people widen their window of tolerance and feel safe in their bodies. And I think that's a huge thing. But I'm also super obsessed with the different biofeedback tools that are out there. So I think there's a lot of ways we work with. We have a health coaching certification where we have a lot of therapy and other providers that are adding health coaching for mental health to their scope. So there's a lot more possibilities than existed in the dark ages when I finished my degree, for sure. I think I was the only one that I knew, minus a couple psychiatrists who were working in nutritional psychology, nutritional psychiatry. I was the only one I knew. And now it feels like there's a ton of people. So it's been really fun for me to watch the development of it.
Yeah. And I feel like, so I have two parts of this. One is that you're right, like the science is coming together in terms of like, on the, again, very ill side, we're finding that people with severe autism, people with severe schizophrenia, they can benefit from changed diets. Like they're often sensitive to gluten. And then on the other hand is what I wanted to say was that I think mental health is everything, right? Like it's not like one of the questions was like, how do you expand into mental health? We're all doing it because we're all talking to people. Like the thing that I think is important for doctors, all practitioners, is that like just talking to patients and listening to them is an intervention. And And because of that, though, that means that if we do it not carefully or not the right mindset, purely from good intentions, it can have a negative impact. So I think that's sort of one of my other soapboxes, is trying to get everyone to kind of have that balance. Like, one of the great things about DBT, which I think is really like Buddhism and Taoism and everything, is it's about balance, right? Is that that both and. So, it can, it's your body can be affected by your brain, and your brain can be affected by your body. And so I think being able to have all practitioners, because I think that we sometimes, you were talking about Chinese medicine and how okay, it's so great. But at the same time, I'm Asian, right? Like, so many Asians are about pushing down feelings, right? And so sometimes when we think about how mental health affects the body, we put it at a bad, that's the bad guy. We need to make all the bad feelings go away, when that's not actually true. Like, all feelings are valid and are important to process and acknowledge. And so much of illness can come from just trying to compartmentalize and ignore it. And so I think sometimes that balance between toxic positivity and toxic negativity, I think is really important. Sorry, like I said, I go on.
Please don't apologize. I got shivers when you're advocating to hold space. Ride that line. How actually, that's something I want to, for both of you or either of you. Ultimately, at the end of the day, we're trying to help people. But you just alluded to something really important. How much are we suppressing symptoms if somebody feeling anxious is a symptom of something, versus how do we create space? Where is that fine line? Where is that balance between creating space for somebody's negative emotions because they're a signal to something, maybe you got to work through something, versus helping them cope, right? How do you make that distinction? And I love the ethnocultural implications of mental health are kind of going off in the chat right now. We do have a talking point to that, which I absolutely love. But I just love to hear, how do you balance palliating symptoms versus, trying to hold space for them?
I always say the feeling is always valid, but the thoughts and behaviors aren't necessarily, And so, so that's so listen to the feeling. And then think about, because I think a lot of times we're okay, we can just change our thought pattern, which can be true, but sometimes our feelings can be so strong and are uncontrollable. But we can't change that either. So it's about, okay, seeing the connections between thought, feeling, and action. And it's not one directional at all. And then validating why you have that feeling, which can be from 50 years ago in your childhood to something going on right in front of you. And then figuring out, okay, well, is the way I'm responding to that, or are the ways that I'm talking to myself about it healthy? And so I think so much of wellness is about breaking the cycle between when you have mental health issues and then engaging in behaviors that are unhealthy.
That's so interesting you say that. I think I have a really kind of unique perspective with it, because working in the nutrition space, I'm not doing a lot about somebody's thoughts about their upbringing. That's not my role. That's not my scope. But what I've heard again and again and again from therapists is that when I do the work that I do with clients, the client is able to tolerate therapy more. They're able to sit with the distress more before, thinking that a feeling is fact, before taking that thought that turns into emotion, turns into a behavior. They're able to stop that process in the middle of it. So it's a nebulous space for sure, but it's been, I think, really fun for me to work in that space, because if a therapist tells me, hey, therapy, this client is able to tolerate 20% more therapy, I'm like, great, this is awesome. So I love working both on the symptoms and just the window of tolerance, really.
Yeah, because I think exactly is that what you're doing is kind of impacting mental health in terms of you're helping them learn like, I think it's helpful to just sort of for everybody to kind of be aware of what kinds of cognitive distortions you can have, right? And so much about nutrition is like, I either eat healthy and it tastes terrible, or I, indulge myself in something I like, right? And so much about nutrition education is about like, that doesn't have to be true, That's, and then the other aspect of you talking about in terms of like small steps is that's so key to changing behaviors or thought patterns. Like, you can't go from one type of person to a different type of person overnight, right? In terms of physical or mental. And so it's all about finding the small steps. And so you're kind of like the stepping stone, because it can be easier to like sometimes change your eating habits than your thinking habits. So thinking leads to eating. So you're like giving them the tools for them to then move on to applying your same principles to their therapy.
For sure. And you're also lessening inflammation in their body so that hopefully, processes work better and we have better neurotransmitter, production and all those things. So it really is a very holistic thing, because it is the activities that you're doing and the experiments and the self-efficacy building. And it's also the shifts in biochemistry, right? And all those things that come from food. So it's a really fun space to work in, for sure.
And what I'm hearing, sorry, Dr. Yang, do you have something else to add?
No, go ahead.
Okay. What I was just hearing there is we're addressing our thinking about our thinking, and how you might judge your thoughts and assess your thoughts and your feelings. And then we're also addressing, thinking about your food. And like, as you referred to, if you eat quote unquote healthy, you eat something good and you think you anticipate you're going to feel terrible, you're not going to love it, it's going to taste bad. Or if you eat something maybe delicious and maybe something a little bit on the sweeter side, for example, and you might judge yourself about it, and what response does that do for you? What kind of biochemical cascade does that set off, and how does that affect not only your physiology but then your psychology as well? We absolutely try. We don't. I know a lot of the practitioners, a lot of the nutrition-focused practitioners on Practice Better at least are very anti-shame, and a lot of dietitians and nutritionists are very much about combating the shame that their clients feel, and the judgments for eating and how that affects your mental health too. And we haven't even gotten on hormones and all of that stuff. But we won't go there yet. But I think what you've also highlighted, especially Meg, when you mentioned the beauty of working interprofessionally, and that's a way to grow your practice. And so I'd love for you to share examples of how your practice has evolved or grown as both of you obviously focus on mental health in different ways. And I'd love to explore where the opportunities lie in practice growth, because of course our summit theme is about practice growth, where the opportunities for growth are in the mental health field.
Yeah, I'm happy to talk about it. I have worked in this space since I did my career change. I changed careers. I used to work in ad agencies of all things, talk about a toxic work environment. But I changed over to nutrition when I myself got sick, and I have always been in the mental health space with it. And I think the thing that really has occurred to me year after year after year, as I talk with colleagues, as I talk with my interns, I talk with other people, there is a huge difference in client retention when you're working in mental health. When you have somebody who has hypertension and their doctor has sent them to you to help with, I don't know, insert whatever here, DASH diet, whatever. There's a lot of extrinsic motivation there. My doctor said I had to do it. There's not a lot of intrinsic motivation. You don't generally, unless it's really bad, you do not feel the effects of hypertension in your daily life. But if you get a client that is coming in for mental health reasons, they are invested. Because again, mental health is everything, not to quote Dr. Yang, but I'm gonna, it is just everything. And so, I have clients that I see weekly for years for mental health stuff. And I think I've gotten a lot of training. I think my retention is generally good, but my retention for hypertension is not nearly as good as it is for mental health. So that shift really, changed the trajectory of my practice personally. And I really love working with people like that. I think sometimes people have this mindset that, well, I really want to get my clients to know everything that they need to know, and I want them to stop seeing me, right? Because they know everything. And I have really shifted away from that, because with hypertension, yes, you can have that model for sure. With chronic mental health stuff, it's more, I've used more of an attachment model where, like, let's do some work. Let's do some intensive work. Okay, you're feeling good? Cool. Awesome. Let me know when you need me. And then we might come back and see them intensively again. So depending on their own bandwidth and the space that they're in. So I really have seen it to be a huge practice builder to work in this space. I haven't taken a new client for, I don't know, a year, because I can't. I don't have space. And it would be very different if I worked in hypertension.
So, sorry, this is, like, I'm going to have two different directions. One, in terms of hypertension, we were talking about how, mental health is everything. And so much of Chinese medicine, I was talking about the spleen and everything being connected. Like, the people with hypertension, they have mental health things. They just don't recognize it, right? They're pushing it down. And so, like, again, even if you are a dietitian that's working with people with hypertension, so much can be like, okay, not just like you need to be doing this, but like, what are the barriers, and it could be that their like wife died or whatever, there's just so much contributing or to the physical symptom that we see. And then on the other side, in terms of interacting with other practitioners, like, I heavily believe in that. Like, one of the things I think is so important that doctors don't know is like, generally is like, what do nutritionists do? What do physical therapists do? What do, like, there's so many different specialties on the wellness side that can help, because the physicians are all overburdened anyway. The only thing is that because it's not as well respected, insurance doesn't cover it. And so it's only when it begins to that what's validated as like sick or not sick. So that's one of my frustrating things, just because I'm trying to take insurance. I am taking insurance just because, like, ethically, even though there are tons of great psychiatrists who don't, like, that's what I feel the need to do. And I learn the best from those people. But what I would my dream is to kind of have an institute, where we all come together and have, do research and just sort of understand how it all works together.
Sign me up.
When can we join? I think if you build it, they will come. And I've often thought about like social enterprise medicine as well, where there's kind of, anyway, I won't get into that, but I absolutely love that, that you walk that, you recognize that not only is mental health often a part of somebody's cardiometabolic situation, right? But then also where and how we can intervene. So what challenges would practitioners face? We also have sorry, I'm interrupting myself, because we also have a really great question that I do want to get to at some point in the Q&A, but we're mostly seeing a lot of engagement in the chat, just to acknowledge that. And so thank you everybody for providing your 2 cents of breadth and depth of experience here. And so what challenges do practitioners face when they're expanding into mental health? Like, when, say, Meg, you have someone who's doing going through your course, or Dr. Yang, when you're mentoring residents, like, what are some of the challenges that people face, and what can they do about it?
Yeah, like, I'm formulating. Meg, do you mind going first? I'm formulating.
Sure. Yeah, I don't mind at all. I think first off, just recognizing that it's possible, right? When I went to school 10 years ago, it was because I had been recently diagnosed with Crohn's and I was trying to fix that. And very quickly, I realized, just like what Dr. Yen's saying, that surprise, surprise, my mental health played a huge role in the development and continuation of that disease. And so I switched my focus. I still deal with GI, but it's really through that mental health lens. So I think just recognizing that it's possible. I talked to a therapist this morning and I was telling them what I did and they went, wait, what? That's a thing? So just being aware of, there's so much information coming out about breath work. There's so much information about energy psychology approaches like tapping. There's so much information about biofeedback. There's so much information now that did not exist 10 years ago about mental health nutrition. So just being aware and kind of tuning into that is, I think it's a barrier just of awareness. And when you get beyond that, it is a little overwhelming, all the resources that are out there.
Yeah. Okay. So again, that's sort of two directions. When I'm teaching medical students or talking to other practitioners, I think the important thing he is teaching them how to talk to patients. And we all learn it in medical school, but then residency kind of like grinds it out of you because you're like overworked. And so much is how to do it also efficiently, how to hear the patient, validate. I have acronyms. I guess I could put that in the thing for that helps them feel heard. And then you can also work with them for change. On the other end is that I wanted to answer, like the converse is like getting holistic wellness into mental health, which is like, again, there's all this biofeedback. There's all these labs, needed in order to figure out like these micronutrient deficiencies. And so for me, that's frustrating is like cost, is like none of this is covered in insurance. So that's the other thing that I think would be important for, I like to call it Dr. Yang's army, right? So there's the science, but then also the lobbying in terms of recognizing that all these things are really important and like long-term will be beneficial for the population. We want to figure these things out before they end up, going to the hospital for hypertension.
Yeah. Yeah, it's there's a lot to unpack there that I think I'll leave. But it's important to be able to support people where they are. And I mean, what you're doing is educating the next. I appreciate both of your roles in educating the next generation of practitioners, healthcare providers in this space. I'm going to move to the chat for a second. Because there's a couple of Q&A that are coming up and I want to, there's a couple more questions that I have and we're coming up on time soon. We've almost got about 10 minutes left. And so Fern has a really interesting question. As a clinical nutritionist, she says she has a hard time respectfully approaching patients' mental health around food issues. And then how do you start that conversation? So how do you talk to people? How do you talk to people about food in the context of mental health? And how they think about food, and how do you start to have those conversations? That might be more of a kind of Meg conversation or Meg question, but also everybody's open to weigh in.
Yeah, I think I'm going to give you a weird answer here. I tell my clients straight off, I'm nosy. I'm nosy. I'm going to ask questions. You tell me you have depression, and I'm going to say, what does that mean? I don't know what that means. You're going to tell me I feel uncomfortable about this area of food, and I'm going to say, I have no idea what that means. And really, honestly, I have never had a client that is not receptive for me just asking a question. Nobody's ever been offended. So, it's a lot of, hey, if I would ask you about XYZ, how would that feel? Mm-hmm. I even ask permission to ask. and I'd say that gets me there almost 100% of the time. I don't know if that's exactly what you're looking for, but it certainly works for me.
That's beautiful. You're being like you're just being politely curious.
Yeah.
Mhm.
I'm just nosy. I just want to understand, right? It's rapport building. I just want to understand. And so when I ask a question like, hey, if I were to ask you to do a 1-day diet diary, like, are we against that or are we here for it? What would that do to your mental health? Would you obsess about it for the next month if I asked you to do that? Cool. We're not going to do that. Awesome. Let's move on. So it's just, it's the client retention and engagement, really.
Mhm.
Yeah.
I'll jump in just because I think food is so important, and one of the, I think, hardest mental health condition is eating disorders, which often starts with trauma.
Yeah.
And so I think so. One is that both the mental health side and the food side, we need to just normalize it too. Like we're gonna with every mental health, we should talk about what your diet is, and also conversely, what does your mental health look like? And I think also I love how you're just like, I don't know what depressed means. It's like I don't know what depressed means either, because 1,000 people can have 1,000 different ways that depression looks, right? And it's just a label. And so so again, like I think it always helps to go back to feeling like what's your feelings about food? How's your relationship with it? And then where does that come from? What does this make you feel? And then that, even just hearing that and like, okay, let me understand that. The more you can understand that and help them show that you accept it, that you're not dismissing it, then the more they're willing to hear you.
Mm-hmm. Yeah.
Both of you meet people where they are so beautifully. Like that is something that so many practitioners are trained in, like meeting people where they are. And those are such beautiful examples of that. Thank you. I'm really torn between the last two questions, because I know we've touched on technology and we've touched on culturally sensitive and inclusive mental health topics, and I don't know which one I want to play favorites. Let's talk let's talk briefly a bit about technology. So what is the role? How do you see that evolving for mental health care using technology?
So can I self-disclosure here? It's embarrassing how many biofeedback tools I have, folks. We're talking in the dozens. Like, I should not disclose this, but I'm obsessed, right? And I started collecting 10 years ago because I promise you, I have a 0% success rate recommending meditation to clients. 0%. I say that word, it's a swear word, meditation. And they're like, no. But if I say, hey, would you like this sexy, awesome app where we can look at your heart rate variability? Wouldn't that be cool? Something like an Aura ring, maybe? Maybe with like an upcoming integration. I don't know. I've heard maybe from Practice Better. Like it's suddenly an easy sell. And so for me, I get around a lot of the resistance people have to kind of that breath work, meditation, all that kind of stuff. I use tech for it. So I'm super excited to see where this goes in the next decade, for sure.
Meg, that was the perfect amount of self-disclosure right there, I think. All right, Dr. Yang, what do you think?
I would love to hear all the ones that you use, but I think I use it also in a ton of arenas. Because I'm virtual, I don't really, I want to get into the biofeedback, but again, it's like getting the items to them in a way that's affordable. But I definitely recommend a lot of different apps, right? There's apps for, anxiety, like plain anxiety, or for, different, maybe not meditations, at least guided meditations, which I think people, it's a little bit easier to do than to just sit there. I also try to tell people, like, meditation doesn't mean having your mind blank or mindfulness. It can be just being mindful of your body. But I love Practice Better in terms of how it connects to everything. And so I've also had very little success with people doing worksheets, right? Or like doing things every day or recording journals, but having it just sort of be easy where they can do something that they're already doing on their phone and then just like link to it is so important. And then I love AI for coming up with things, like saying that specific to who they are, right? So if I have a recommendation, but I know that they are a plumber, I might like figure out how to write it. I mean, usually I do that, but now I'm trying to be more efficient with my time to just make it quick, to be like with this, analogy. And then I also recommend how they can use it and like empower them to figure out ways that they can like ask ChatGPT. Or I've had one patient who's afraid of travel sign on to Instagram and look at pictures of Iceland, So it can help with visualization. I recommend a lot of different Instagram people, who can just give more advice. So.
All right. So it's interesting there because it's not only these technology tools not only makes your practice potentially helps your practice and make it more efficient, but it also obviously brings a lot of can bring additional insights for people in there, that the effect of their environment or their thoughts on their physiology and vice versa. All right, last question. It's a big one. How can practitioners ensure they're providing culturally sensitive and inclusive mental health care? A really important one, I know. Yeah, I know, Dr. Yang, you have especially from you want to be financially inclusive as well, and I know you strive for that. But there are plenty of other ways to be inclusive as well. So I'll let you take it away.
I mean, I think so much is recognizing your own place in the world, and so and how you came to it. So I think a lot of times the difficulty that other cultures and races have is that they're not the default, right? But one of the questions can be like, well, how do you get to the default? Like, what is it that you've grown up with that led you to how you see the world? Like, the more you recognize all of those little steps that get to where you are, no matter whether you're default or not, can help you then see how those things could be different and then lead to people seeing things in a different way. I think one of the things that is helpful when I talk to patients is I make the unsaid explicit, or like so like if there's like tough things going on, I don't just say like, and there I say like, I might be wrong, but I would understand like with like the Black culture that this time period would be really tough right now. And they could correct me and I'd be like, okay, thank you for teaching me. You're like in a completely different place. But sometimes if you just, the one thing that I can fall into trap is if you just ask them, it sometimes puts a lot of the homework on them. So I think so much is like doing a little bit of homework within yourself in order to just try to imagine. And then you can be wrong, but I think just naming things for them can be helpful.
Amazing. Meg, do you have a point of view that can fit in the next maybe 60 seconds?
On anything?
On the mental health and inclusivity. Unless you want to not want to weigh into that answer, you don't have to.
No, I think, I was, so back in the day when I still had an in-person office, I'm working from my home office right now, but pre-COVID working, I was very close geographically to a community that was very predominant in a religion that was not my religion of origin. And it was a lot of learning. But again, it goes back to that relationship, right? It's half that curiosity and rapport with the client. And it's half like, yeah, I'm going to get some additional training and I'm going to get a case consultation and I'm going to get some supervision on this from somebody who knows more than me. So it's all those things. And again, not being afraid to ask a question. Sometimes I think people get in our head about feeling like we have to know everything and we don't.
Yeah. It's hard not to feel like you have to know everything. I have 30 seconds. there's a lot of unanswered questions about where to get more resources to learn. I have a funny feeling that's going to be in the swag bag, links to Meg. So I'm going to point to that.
Yeah.
And please, let's continue the conversation in the community about resources and about apps and all of these wonderful discussions that are happening. But I wanted to thank you both today for your amazing insights. And next, we've got another big keynote presentation. So stay tuned. Thank you.
Thanks
Thank
much.
you so much.
See ya.
Thank you.